Dr. Eunice Coles, who thinks the burden on GPs should be reduced and the patient should be charged for A&E visits. And Mike Bewick, the Deputy Medical Director for NHS England, he says GP surgeries should remain the first port of call. Let's hear more from them. And Dr. Coles, first of all, just listening to Sarah Jarvis there and her workload, I suppose a lot of GPs listening to that will say, well, that's fairly typical. Can GP surgeries bear even more of the burden of primary care now?
No, they can't. There's a national shortage of GPs. We're in a crisis situation. We have to remember that general practice is not an emergency service. We should not be open 7 days. We're a primary care service. A lot of GP surgeries are using skeleton staff at the moment. They're barely able to cope. It'll take probably 10 years before we increase our GPs to 10,000. So, no, it's not a realistic it's not a realistic eventuality.
OK, Mike Bewick, what's your answer to that? Without 10,000 more GPs or so, a 7-day operation of surgeries is not going to happen.
Well, I think it's important to say that we're not trying to replicate the 5 days as 7. We're trying to develop a system that makes it safer for patients at weekends, and primary care has a part to play in that. As your introduction stated, over 80% of activity in the NHS occurs in primary care, and we do need to invest strongly in it to make sure that transfer of care that comes from the secondary care sector into primary care, as NHS England has signalled, is well resourced. However, we've got to make sure that we invest in the right places, and it's not just about the numbers of doctors, it's about support staff, but it's also about investing in technology so that patients can use other means to contact and get services from the NHS. And this is all part of NHS England's strategy to do so. OK, so
you are saying in a nutshell that with all those different ways of doing it, and you're not replicating 7 days compared to the 5 days, it can be done with current resources and current numbers of GPs?
I think there's an argument that says that it has to be done in current resources because the NHS isn't going to get more money. However, we are trying to divert some of those resources, and the Better Care Fund that's coming in 2015 is showing that over £3 billion worth of investment is coming out of the acute sector and into the community sector, and some of that will come into primary care. We also realise that there's a demographic change where both a rising population and a more complex population in terms of the elderly, and as you also mentioned in your introduction for a future date on Wednesday, I think you said, looking at vulnerable patients, and we've got to adapt to that. Okay. And we already know that Health Education England is putting in those plans to increase the numbers of doctors in the community.
I know Dr. Coles knows all about those plans. Well, do you think then, having listened to that from Mike Bewick, Dr. Coles, that it can be done with resources diverted from other parts of the NHS, a re-emphasising of priorities, that therefore GP surgeries could bear more of that burden?
No, what's happening is that they're taking away GP services from GP practices by tendering them out for competition to any qualified provider. My concern is patient safety. If we want to make it a more efficient service, it's already trying to operate on a very limited budget. So my concern is international, national, charitable organisations will try to compete with GP surgeries and take away their LES services already, which is the income for GP surgeries. I'm worried about the fragmentation of general practice and about patient safety, because where are you going to make those cuts in the quality of staff and the services you're providing? It's very worrying.
I mean, do you accept that, Mike Bewick, that there's almost a privatisation going on here by the back door?
I don't think that's true at all. I think what Dr. Coles is alluding to, a small number of APMS contracts and also the enhanced service contracts, which are held by the clinical commissioning groups, some of which will come up for tender. The vast majority of services in this country are not up for tender, and we're not disinvesting. In fact, I'm trying to lay out plans that we are investing in primary care to make it safer. Okay. One other aspect we haven't touched on is how GPs can work together across communities in federations, and that's another important milestone in how we'll achieve this.
OK, well, we will touch on that perhaps at a later date, but I just want to further explore Dr. Coles' idea, which we haven't discussed right here, about charging in some way at A&E departments, because, of course, people are being diverted there because they can't get to the GP surgeries when they want to.
Are you asking me that?
Dr. Coles, first of all, what, £5 or £10 to go to an A&E department?
I think it's unfortunate that we have to come up with some solution like this. There are a lot of visits to A&E that are needless. There are DIY incidents, there are splinters in the finger, there are bumps and scrapes. And we basically have to teach the public that, look, accident and emergency is for life-threatening conditions. We're trying to save lives and make sure the patients who are unwell get priority. Another solution might be to take away the 4-hour target so that the people who are there who don't have emergencies just go home and leave it there for people who are seriously ill.
And lastly, any thoughts on that, Mike Bewick? The idea, well, so no privatisation of GPs' surgeries, but a form of privatisation, I guess, charging anyway at A&E.
I just don't think this is doable, I don't think it's desirable, and I don't think we should do it.
OK, well, thank you for your brevity, Mike Bewick. Very good to see you. Dr. Unicols, thank you too.